you, Anooka. So this morning, we're going to have three individuals who are working in the healthcare innovation space. The first of these is Jacqueline Summers. Jacqueline is the managing director and co-founder of the Alaska Health Tie. Health Tie is an innovation hub providing a bridge between health and human services organizations and innovative entrepreneurial partners. Health Tie provides an open platform for entrepreneurs to share their ideas and build relationships for funding for pilot projects and with potential customers. Jacqueline also represents the Alaska Dementia Action Collaborative, which is a coalition of public-private partners committed to preparing the state of Alaska and Alaskans for the growth of the population that will be experiencing dementia. The second person who's joining us today is Emily Bile. Emily is an occupational therapist and an owner of Well Haven LLC, which provides home safety assessments, customized in-home and virtual rehabilitation, caregiver support, and education to improve the quality of life for older adults. Well Haven's goal is to keep adults independent and safe and to reduce the healthcare costs associated with hospitalization and institutional care. And finally, Sameer Peesapati is a serial entrepreneur, inventor, usability and safety professional with over a decade of experience in healthcare and medtech. He's the CEO and co-founder of Anooka Health, a digital care platform for chronic pain, which is designed to help chronic pain sufferers live high-functioning lives. So I want to very much welcome Jacqueline, Emily, and Sameer to our program. We will start with Jacqueline. Juanetta will bring in the speakers in series as each gets done. And then after we've had the prepared remarks from the three individuals, we will open it up for Q&A as Juanetta indicated. So Jacqueline, if you want to unmute and carry on.
Much, and Juanetta, if you wouldn't mind sharing our slides, that would be awesome. Well, welcome everyone. Thank you, Ralph, for that wonderful introduction. And thank you to Juanetta Ayers with Commonwealth North for inviting us here today. I'm so excited to share the work that we're doing both independently as well as our collaborations. As you've heard, we're three independent organizations. So we'll each tell you about our work that we're doing in chronic disease and pain management, and then also tell you about our work together. So we're doing things a little bit differently today. We're joining you from three different locations, 2 different countries and 2 different time zones. So super excited to tell you about this work, but also to answer any questions at the end. So next slide, Juanetta, please. So as you've heard, we're 3 different presenters. I'm Jacqueline Summers. I'm the managing director of Health Tie, and I am based in Anchorage, but my program works throughout the state. After my presentation, Emily Bile will present. She's the founder and director of Well Haven Occupational Therapy. And rounding out our conversation will be Sameer Peesapati with Anooka Health. He's the CEO and founder of that organization, and he's presenting from Toronto, Canada today. He has worked in Alaska previously, and his program works throughout North America. So thank you. And next slide. So while I'm here, what I'd really love to tell you is how much I've appreciated the other presentations in this series, including one from Ralph Townsend with ISER when he spoke to us a few months ago about the changing demographics of Alaska. What we learned from Ralph is that Alaska is getting older and grayer. And that means that people who are living here longer with chronic conditions. You also heard from the other presenters that Alaska continues to have some of the highest healthcare costs in the United States. And a large majority of those costs are going toward managing chronic conditions, including chronic pain. What I especially appreciated from the Anuka system of care presentation is that understanding that healthcare is really moving away from being managed directly in a provider's office. So a lot of healthcare is now being embedded in our day-to-day lives. And what we learned from Dr. Doug Eby is that that is really a positive development, that healthcare really, in order to be effective, we need to have people partnering with their healthcare. And you may also be doing this interactively. Maybe you're somebody who wears a Fitbit or an Apple Watch, and you're taking that information into your care provider and asking, what do these numbers mean? What could I do to lower them? Alternatively, many healthcare systems are now asking patients to provide information on a daily or monthly basis. Maybe you're somebody who uses a CPAP, or maybe you have a cardiac device that is uploading information. So as we move forward, healthcare is changing. We're now managing chronic conditions, but we have this huge opportunity now that healthcare is being done in our homes through telehealth and through technology. We have this opportunity to better understand it and manage it better. People want and deserve a partnership with their healthcare system. And what's nice is when you empower people, and you'll be learning more about this from Emily and from Sameer, but when you empower people to take a really active participatory role in their healthcare, those healthcare changes improve, and the costs are reduced. So amidst all the difficult news that we have some of the highest healthcare costs in the United States, and that many of those costs are going toward chronic conditions, what I'm here to tell you about, what Sameer and Emily are here to tell you about, is that there's true opportunity right now to make a huge difference. Next slide, please. So this is the organization I manage. I see some of my healthcare, my advisory board team members here. I couldn't do this alone. A huge thank you to the Health Tie Advisory Board. What we do collaboratively is that we are a healthcare innovation hub that catalyzes new ideas. We also incubate new healthcare entrepreneurs here within the state. And I work broadly across the United States and even throughout the world, and invite entrepreneurs with unique ideas to come in and see how they could positively affect the Alaskan healthcare system. And I'm here to tell you, there are so many exciting ideas that are happening. What's really our choice moving forward is which one will we select? There's a lot of new ideas coming through technology. So one of the best things that happen is that we bring the change makers together in order to make these positive changes. And one of the primary ways that I do that is by hosting open innovation twice a month. So much like this forum, we bring people together to highlight a new idea or a new technology. We then ask questions and share connections. We then move forward, ideally, once those connections are done, with launching a pilot project. I have a series of those now going on throughout the state. One of the things that happens with Health Tie is I always like to say other people work with dollars, I work with connections. That's my currency. So I like to make connections. I did connect Emily Bile to the Dementia Action Collaborative. They now know that she has these important services that can be provided to elders throughout the state. I also connected Sameer and Emily, who are now collaborating together, and you'll hear more about that in just a minute. Since you're here today, I'm going to invite you into our tent. You are also a change maker. You're somebody who wants to make the whole system in Alaska better. So please, if you can, join us. The open innovation presentations are the second and fourth Thursday of every month. They're 30 minutes long, so they're pretty short, right after lunch. We'll get you going, we'll get you excited. In fact, Sameer will be providing an open innovation presentation later today at 1 o'clock. So I'll try to share that information in the chat. So next slide, please. So I work primarily in 4 different areas. I work with healthcare. What I like to say is healthcare in the community. So I work with organizations, primarily social service organizations that work with substance use disorders, behavioral health disorders, physical and mental disabilities. And another area I'm really focused on is elder and senior care, especially Alzheimer's and dementia care. So what you see here are a series of businesses, startup companies that are working in the elder, senior care, Alzheimer, and dementia space. And we have a series of pilot projects with these organizations going on right now. One thing that I really want to point out is that all of these organizations came together recently to promote and support the Hospice of Anchorage's Care for the Care campaign. So I learned that the Hospice of Anchorage had a program that delivered care boxes to individuals who are looking after somebody with Alzheimer's or dementia in their home, and that when they'd done it previously, it had been a really good way to support those people, make a connection, and share resources. And they were in danger of not being able to do it this year because they didn't have enough funding. So I immediately got on the phone and called my entrepreneurs, reached out to my entrepreneurs, and we crowdsourced a way to both through in-kind services and financial contributions, make that program happen again this summer. So now 350 different Alaskans will be getting care boxes and resources in June, July, and August. So this is such a really good example of what Health Tie is able to do. We bring people together and make exciting things happen. In fact, it's my premise that if you get the right 3 Alaskans together, you can make anything happen. So with this good example of the Care for the Cares campaign, I have a little bit of homework for you today. And that is, because we run on connections, throughout our presentations, if you can think of any organization or an individual who would like to connect with us or learn more about the work we're doing, if you would please put those in the chat, that would be awesome. Thanks so much. So this is my opportunity to go to the next slide, please. I'm sorry, next slide, please. Yes, thank you so much. So this is my opportunity. I'm going to hand this presentation over to Emily now so that you can learn more about her work in the community. I'm so excited to invite her to be here with me today. She is the epitome of a change maker. She is someone who, through her work, saw that there was a real need in the community and has now created a business specifically to meet that need. And while I still have the microphone, I just want to say a big thank you to Sameer, who, as you've heard, is a serial entrepreneur, and he has generously provided his expertise both to Emily and to me. And just very grateful that he's agreed to be here with us today. So thank you. And Emily, I'm now going to hand it off to you.
Good morning, everyone. I want to say thank you to Commonwealth North for having us, and thank you to Jacqueline for helping me through the startup process. And she's very much opened my eyes to the importance of establishing partnerships and working together with other organizations in the community, and to Sameer, because we've been working together over the past few months to try to create some change for people with chronic conditions. I am an occupational therapist, so I work with older adults who are experiencing functional decline in their daily lives, whether that be from age-related illness, stroke, and lately more Alzheimer's and dementia. I started my OT career in an Alaskan hospital, and that's when I noticed that many of my patients were being discharged to rural communities where they may not have the type of support that they needed to stay safe at home and to reduce their hospitalization, reduce the trauma of being rehospitalized, and didn't have the support they needed to continue to care for themselves as independently as possible. And I saw that a lot, particularly with older adults with dementia. They either didn't have the support they needed at home, or they had caregivers who lacked the education and support they needed to provide that care for someone with dementia, because it is a 24/7 job and it's very difficult. Some of these some of these patients didn't have outpatient OT in their communities, and many of them ended up staying hospitalized for very long periods of time because they didn't have access to family caregivers, or there were no assisted livings in their community and they had to wait for placement in Anchorage. And based on the research, we know 70 to 80% of persons with dementia will remain at home. So focusing on making homes safer and equipping caregivers with the skills they need is something I'm very passionate about. Could you go to the next slide, please? So one of the programs that I offer through my business, Well Haven Occupational Therapy, is called Skills to Care. This is a program that's delivered by occupational therapists via either home health, which is Medicare Part A, or outpatient, which is Medicare Part B, or as a caregiver coaching program, which can be supported by organizations in the community. And this is a program that knows that the families and other informal caregivers, typically not paid caregivers, are going to be the principal source of support. And the caregivers themselves require the knowledge and skills to be able to care for their loved one. If you can advance, please. So the Skills to Care program was designed by researchers at Thomas Jefferson University. It's non-pharmacologic, it's evidence-based, it went through randomized controlled trials, and they found that for the caregivers and patients who participated in the program, caregivers demonstrated improved knowledge, skills, and well-being. It reduced their caregiver burden. The patients themselves needed less assistance to complete their activities of daily living and self-care. It helped reduce some of the problematic behaviors that we see with Alzheimer's and dementia, like agitation, anxiety, wandering, and it increased those patients' participation in meaningful activities. You could advance the slide. The biggest component of this program is helping caregivers understand why behaviors occur and how to adjust in response. So it's not just because they have dementia. There's the theory behind Skills to Care is that behavior is a function of the person with dementia and their interaction with their environment and their caregiver. So it takes into consideration the person's with dementia, their medical diagnoses, whether they have other comorbidities like I said, like a stroke, or maybe they just were hospitalized, so they're dealing with some deconditioning. Also looks at other health conditions like urinary tract infection, pain, depression. We take a look at what medication the patients are on and how that may be impacting them. And then also their internal state. Are they feeling fearful, confused? Do they have a sense of loss of control? So we think about the person with dementia and what is going on with them physically, mentally, and emotionally, and what can be addressed to make things work better in their home. It also takes into consideration the caregiver and their communication approach. Do they raise their voice when they work with the person with dementia? Do they use negative comments? Do they give too many directions at one time and the person with dementia is unable to process that and respond? How do they manage the home? Is there a daily routine in place or is it an unpredictable day-to-day? And what is the stress level of the caregiver? Because we know that can directly impact the person with dementia. The last factor in this model is the physical environment. So we look at what is going on at home that may contribute to the behavior. Is there too much noise? Is there a TV blaring in the background? Is there too much clutter that makes it hard for the person to focus? Is there lack of activities or things that the person with dementia can meaningfully engage in? And one of the biggest aspects is safety. How are they able to move around their environment? Are they able to get in and out of the bathtub, on and off the toilet safely? So those things we also take into consideration. If you could advance, please. So this is an overview of the program Skills to Care. The first part is the assessment. We work directly with the caregiver to ask them what are their problems and needs, what's important to them for us to work on. It's client-centered, so we want to make sure what we are working on will immediately impact both the caregiver and the patient's quality of life. Another factor is the caregiver readiness to change. So some caregivers are ready to take action. They want new strategies, they want ideas, and others are not. And we take that into consideration as an opportunity to just provide education on dementia, give them a few tools they can use, but be there to support them if in the future they're ready to add more strategies to their tool belt. So we look at their communication style, their management style, as far as what they're expecting of the person with dementia. And then one thing that we do for each family is a depression screen for the caregiver, because there's a very high percentage of caregivers of persons with dementia that experience depression. They often put their own needs on the back burner. They may be putting their own health on the back burner. So it's a way for us to identify what needs are going unmet with the caregiver, and to help give them the resources they need so they can also address their own health. They need to be able to take care of themselves if they are going to be a long-term caregiver for their loved one. And then again, the assessment includes a home safety assessment. Then we move into teaching. So again, when we look at caregiver depression and their ability to take care of someone with dementia, we teach caregiver stress management techniques. And the biggest thing we do is help them understand a problem-solving approach to any situation that they may encounter. So if the person with dementia is experiencing anxiety and agitation, we talk about what time of day are they experiencing that? When does this not happen? What have you done in the past that's worked? What have you done in the past that hasn't worked? So we pull in their own experience, because they know this person best, to develop strategies, which then lead into our action plans, where as an occupational therapist, I'm able to have a more objective view of what's going on and be able to offer strategies to address the agitation. Like, does that person have anything to do all day, or are they set in front of the TV because you're not really sure what else to do with them? Well, that's going to create some anxiety, and boredom can lead to agitation as well. So we have customized action plans based on a variety of behaviors that we're trying to address, anything from incontinence to wandering at night, to like I said, agitation, and there's a whole host of things we address. We take it one step at a time. So we're building the skills of the caregiver. They're involved the entire time. This isn't a prescription that we write and just hand to them. They're part of the process. And this is so that they can generalize these skills to other situations, because dementia is progressive. So new behaviors, new challenges will come up. We want them to be able to step back and say, okay, I can see that this environment is not setting this person up for success. How can I change the barriers here so that we can minimize these behaviors as much as possible? And then at the end of the program, we measure our outcomes. We take into consideration how the caregiver upset score. We take that at the beginning and at the end, and how confident they are in being able to address situations, and have we resolved the current issue. If you want to advance the next slide, please. So the core treatment principles that I touched upon when I was describing the program is it's very client-centered. We're driven by the needs of the caregiver. We're basing it on their readiness to change. it's also culturally relevant. Everybody's home is different. Everybody, the way they function in their home is different. So one set action plan is not going to work for each home. So we identify what does success look like to this person, what's important to them, and go from there. And that's where we focus on. Again, we model for the caregiver how to solve daily problems and help them build their own skills so they can become more independent and confident in their abilities. So this is a program that's research backed. It has not been utilized in Alaska yet. And so this is part of my practice, is bringing this to Alaska to help build up caregiver skill, decrease difficult behaviors, prevent unnecessary ER visits, hospitalizations, and potentially placement if it's important for that family to keep their loved one at home. And we know, based on all the research that's been done, the number of people with dementia is projected to double within 30 years. And that's in the US, including Alaska. And right now I'm utilizing this program with a hybrid model of some in home if they're in the Anchorage Bowl area, and then along with telehealth, so we can increase the access to this information and to help people learn the strategies. The reimbursement for this program is, if it's medically necessary occupational therapy, it's covered by Medicare. So that does help with being able to, some people to access it. I'm hoping that the public health emergency that Medicare is reimbursing for telehealth will continue after this summer, but that's a huge issue because we obviously need the people and patients in rural Alaska to be able to continue to access care. If you could advance the next slide, please. So my goal is to grow and create partnerships with other community organizations so we can serve more rural Alaskans. And that will most likely include telehealth, but my communication and my collaboration with Sameer has also opened my eyes that there's other ways to work with people in rural areas who may not have consistent access to a regular appointment or your traditional appointments with a therapist or another provider. And how do we use the technology that is coming available to reach people and provide them education, maybe asynchronously, be able to monitor them remotely. So we're still supporting them, but we're being more creative than the one-to-one model that we're typically seeing. So Sameer and I have been discussing over the past months how we can collaborate in order to reach patients with chronic pain and potentially other conditions in a way that's very accessible to them and can help them, as Jacqueline said, have their healthcare be a part of their daily life instead of the one-to-one appointments. So with that, I will now turn it over to Sameer.
Thank you, Emily. Firstly, thank you to Commonwealth North for having me, and also for Jacqueline to putting us all together to give this presentation. Could you please advance to the next slide? So I'll start with a short story behind how we started off with Anuka. So during the pandemic, I was trying to help both my mom and mother-in-law address their sciatica and joint osteoarthritis. And we were figuring out how we should increase their physical activity because they were living with a lot of pain. And that sort of started off as the starting point of how you can modify a person's health and behavior to help them stay on course to exercising regularly and eventually experiencing lesser pain and being able to do more activities daily. And we have interviewed more than 150 people who live with pain during this journey, and we saw how difficult it is for them to make lifestyle changes. When you're living with constant pain, you're sort of expected to visit people you have to make appointments, you have to be physically present, and by the time you are physically there, you're completely tired to do any other activity for that day. So when we look at all these things, it's really a big, complex situation for them. And a lot of times, people address it only with pills or biologics, and this is not sustainable in the long term. And could you please advance to the next slide? So this is where we started building Anuka. So Anuka is basically a digital health and behavioral coaching platform that identifies, what helps them make, behavior change towards their health. We look at how we can improve their health literacy, improve how well they understand their pain, how to address it, how can we increase their physical activity, and how can we guide a person towards healthy choices. We do this by pairing the person with a health coach, typically who has also training in allied health, someone like Emily, for example, and who can understand what can allow a person to make those behavior changes. Could you please go to the next slide, please? So we use research-backed methods. So we apply cognitive behavioral therapy that has been devised for both chronic pain and insomnia, which is one of the bigger issues people with pain experience. Virtual exercise and movement therapies have been proven to be effective non-pharmacological alternatives in several randomized clinical trials also. And we also help people not journal how pain is impacting their lives, so we can understand in free-form text, what else is happening that is not allowing them to make lifestyle changes. So it is a combination of several research-backed methods that our coaches apply, along with access to our application to help have them access to healthcare at all times. Could you please advance to the next slide, please? So the way our platform works right now is people go through a quick onboarding process so that they can pick their coach. And after they have picked their coach, they will do a thorough assessment. They meet with their coach for 60 minutes to figure out what their health goals are, how pain is impacting them, what changes they would like to make. And after that, they would receive access to our platform with the initial care plan preloaded so that they can start working together with the coach and continue making those changes. Please go to the next slide, please. And so far, we have designed Anuka to work with people who live with joint osteoarthritis. So these are people, we have a similar problem in Canada, in US, in many places where I worked, and this is definitely bigger also in Alaska. A lot of people live with arthritic conditions when they're living in colder regions. And we see that Anuka can benefit a lot of people who are living with joint osteoarthritis, who also potentially want to manage their weight. So the risk for considering a joint replacement goes up. People who are living with rheumatoid arthritis, we have worked with people who are living with chronic musculoskeletal pain, conditions like fibromyalgia, where you need to understand what kind of behaviors would reduce the suffering for the experience with pain. We're also exploring a couple of new use cases around chronic pelvic pain, which is something that we have heard due to severe shortage of pelvic floor physiotherapists. So we see that we are evolving as a bridge between healthcare and wellness, where you can basically have access to well-vetted health choices that help you live with less pain. So at this point, I would like to hand over to Jacqueline.
Thank you so much, Sameer, and thank you, Emily. So as you've seen in that last slide, that was our contact information. We can each put maybe our email addresses in the chat if anybody would like to contact us. And remember your homework. If you have ideas of where we might find connections, please share those. Juanetta, if you wouldn't mind, I would like to do a thank you to Health Ties sponsors. That I shared that on that last slide, or second to last slide, but I'd especially like to thank the Alaska Mental Health Trust and the Mat-Su Health Foundation, who have been Health Ties supporters right from the beginning. And of course, we're also a part of the UAA Business Enterprise Institute, and Anchor Point has also been a big supporter, as has Champney Consulting. So thank you so much for that. And so as you've seen, we've gone through our presentations and we're now open. I see that Juanetta has already started to ask some questions about who we might be connected with. If you want to maybe stop sharing the slides, what we can do is now just open this up. We're a little bit of a smaller group, so it'd be nice to just have an open conversation and answer questions.
Okay. Thank you so much, everyone. I'm going to bring all three of you back on screen. And Ralph, I wanted to ask if you wanted to start with a question.
Why don't I start with just a broad question for all three of you, and that is, what kind of changes are both going on in the policy environment, but what kind of changes are still necessary for us to, move to more integrated kinds of strategies? And again, you tend to focus on older adults, particularly those with chronic illnesses. So what's the policy environment look like, and where does it need to go?
I'll go first and just tell you generally, I think because Emily manages a lot of the billing and those sorts of things, as does Sameer, they can probably provide you some more details. One of the biggest challenges that Health Tie faces is that many of the innovations that we work with providers to introduce are not reimbursable. So for example, there's a smart pill box that I've been working with. I shared that. It's called Dose Health, that can go into a senior's home and be able to automatically dispense medications when they need it. It also sends information to their doctor, their care provider, and maybe a daughter or a son or a family member, so that they know that mom or dad is taking their medication when they should. The challenge for that is it's not reimbursable right now through the state. So the state will pay for a person to provide that care, but not, as far as I know, right now, the way that the process is set up through Medicaid and Medicare is that this device, or alternately, the reimbursement is so low, it's like $80 every 2 years, that it doesn't provide these devices. So that's one of the big barriers that I'm facing. I see that there's a lot of knowledge here on the call. I would imagine Preston, for example, would have more understanding of this. But Emily or Sameer, did you want to answer that question?
Yeah, I can add to that, because Emily and I have been working on some newer codes that are taking shape. One is category 3 codes around health coaching issued by CMS, and the other is remote therapy monitoring codes for respiratory and musculoskeletal health monitoring. I think it would be very vital for us to understand how these new codes will be implemented in Alaska and how the reimbursement will look like. Even for us as entrepreneurs, it's really hard to scale the business or to actually implement if we don't have a pathway laid out for reimbursement, so that we can go market to patients, educate them, and get them on board. So I think it is very vital for us to understand how this would play out as time progresses. So it helps someone like Emily or myself also do proper business planning and say, these are the resources we'll need. This is how we need to educate people, and this is how much people will get reimbursed, and these are the clinical outcomes that we are looking for.
Yeah, sorry, my video cut out a little bit, but I think I heard the majority of what Sameer said. Like he said, the CMS has new CPT codes to be billing remote therapy monitoring. So that's still, people are trying to figure out how that necessarily works. So we'll see as we work on that in the future. I think for me as an occupational therapist, I can see the benefit of preventative care that's just not covered under Medicare or Medicaid, that could reduce hospitalizations. One thing I run into a lot is when we talk about durable medical equipment, Medicaid will pay for some durable medical equipment for people who need it, like a tub transfer bench or something like that, but Medicare does not. And so we run into that quite a bit when, if you recommend some equipment, but it's not reimbursable, that could potentially lead to a fall when it's, $150 piece of equipment. that can be a barrier. And so I see, you know, if we look at these therapy codes, I think they'll be one part of the puzzle. But I see more being on the shoulders of organizations to do more preventative wellness work. So we're preventing people from having to be hospitalized, leading to more comorbidities, leading to placement.
Maybe I can do a follow-up here because, you know, we tend to treat Medicare and Medicaid as being, you know, they're both federal programs, but the reality is, of course, Medicare is a federal program, Medicaid is a state program, and in this case, for Medicaid is the payer for nursing home care for many elders. So I guess, you know, a couple of questions on the Medicare side, and maybe Sameer has some experience with this. Does moving towards Medicare parts, Medicare Advantage plans, which we don't have in Alaska, in other states we have there are Medicare Advantage plans that are more open in terms of the scope of services that are provided. Different Medicare Advantage plans provide different degrees of coverage based on a capitated model. And so one question is Medicare Advantage, which perhaps we'll see in Alaska, Preston says we're going to see it.
In 2024.
So one question is, will that address any of the issues? And then the other question is, in terms of Medicaid, are there specific issues in Alaska that Medicaid can address in this area as a state structured program?
So from my experience working in New York, so we implemented a BPCI value-based care model at Northwell. This was more focused towards joint replacements, post-op, CABG patients. So there is, quite a bit of utility for having Medicare Advantage. The most important thing is how long will there be remote or telemedicine coverage available. And this is really critical in a place like Alaska, as opposed to downstate New York, where you're basically flooded with physiotherapists. So I think that capacity planning, knowing like how one person or one occupational or physiotherapy unit can serve not just a lot of people, but also people from a wider geography, which is the nature of Alaska. So we have to have more of like how that can be supported. I think that's where Medicare Advantage has some benefits. I definitely don't know the finer detail of where it suffers.
So part of this, when you're talking about the reimbursement, it really is about our economic model up here. So when under fee-for-service methodology, which we have about 98% up here, these are all additional costs because they're not under a covered type component. But as we do move into value-based care, I think the state is starting to, I think COVID got in the way, but, under managed Medicaid makes great sense in some of the more concentrated population areas. And then, we're working towards bringing Medicare Advantage up as kind of the first foray in 2024. Which is kind of right around the corner. But when you start thinking about these type of programs or innovations, those will help people keep you healthier and keeping out of the emergency department, just like we're seeing around the care navigation and those type of things that you saw. There's one of the things, some of these also, I think both these have applicability to would be direct D2C or direct to consumer type products where people would find value in those. So one of the questions I had, how are you actually creating awareness around for these products or programs across Alaska? As you noted, there's a huge increase in, dementia over time, and it's going to get worse. As the population ages, we have, there's one of the fastest growing in the country aging populations in Alaska, more people are staying here. There's a lot of the arthritis, chronic, pain, those type of issues. And these type of apps or assistants, just because there's not a lot of knowledge around the dementia, or keeping, as a caregiver in the homes, and as, elders stay in the homes, or, how to treat the disease, especially in rural Alaska. How are you creating that awareness for maybe a subscription type service or so forth?
That is, oh, sorry, Jacqueline, go ahead.
Well, I will just briefly speak and then I'll let Emily go. One of the ways that we're raising awareness, President, is by presenting at events like this, but also yesterday, Emily and another provider, Brianna James, were on Line 1, Your Health Connection. So we are slowly trying to raise awareness that way. But if you have ideas of how we can share this, it would be awesome. Go ahead, Emily.
Well, I was just going to say that's something I'm exploring, because I know that there's a big need, but it's how do we get out the information to the people who need it? So one thing I do that's direct to consumer is aging in place home safety assessments and helping with modifications for people who are still fairly well and healthy, but are trying to plan for the future so that we can prevent some of those health issues and keep them in their homes. But as far as the caregiver training, I'm still trying to figure out, how do people want this information, and in a way that's accessible to them, affordable to them, and still effective. So any ideas, I'm open.
Yeah. Your other issue is, as you try to promote these, is going to be the scalability and the consistency of what you can offer. Now, tech platforms that are kind of self-generating are going to be easier on that front, but something where you're doing the coaching and those type of things, that's hard, especially with the workforce issue. So that can, that's going to be an issue. The other question I actually had is, in terms of the geography and ability for tech to scale across Alaska is limited by our broadband capabilities and so forth. But with the infrastructure bill coming in, have you been thinking about how you can maybe get in front of that to help support these type of products so they'll work in the villages or the smaller communities and those type of things?
Yeah, I'll be happy to talk on that, because we are exploring an initiative in northern British Columbia, which is having similar geography and similar broadband issues. I think one of the initiatives I worked in the past was remote diagnostics for tuberculosis in India. And the big challenge we faced there was, how can we bring our technology there, and how can we monitor the progress of people who are getting treated for tuberculosis? Similar principles is, we need to establish liaisons who can basically take the tablet or take the mobile device at a centralized location and collect information, or can go to their places to collect information. So there are different ways we can implement this, because we experience these challenges here in Canada also. When you just drive like 60, 70 miles north, then you're pretty much driving into wilderness after 60, 70 miles north of Toronto. So this is basically something that needs to be addressed. There's also an additional, what Emily and I have been discussing in the past was also, it could be an additional employment opportunity if we develop these liaisons, and if we train them to be coaches, if we train them to do this vetting, then it could be a potential employment opportunity. Something that we were able to do in India. We were able to train a lot of people in phlebotomy, in doing this kind of liaison work.
And one other suggestion for you might think about, so is one of the things that are starting here in Alaska, but pretty prevalent around the country are, and there's a lot of competition in this space, but so you start getting into bundles. So you think about an orthopedic bundle, and the pain management or recovery after that, in terms of happening. If you could connect your product into those type of bundles for hips, knees, those type of things that are way more prevalent. They're done in the ambulatory surgery centers now, and this would be a good recovery option for folks that could be incorporated into something like that longitudinally. So if you haven't thought about that, I would encourage you to kind of get that thought process as well, because those are taking off really fast.
Okay, I think we have a question from Elizabeth. Bring her.
Yes, good morning. First of all, I just wanted to commend you and thank you for caring enough to be in this space to provide supports for older adults. I just returned from almost a month with my mother on the East Coast, who was sidelined by a drug complication that almost killed her. And she's 83, and we're trying to get her living independently again. And it's been a journey. At the same time, and she's in Maryland, my dad's in North Carolina with Alzheimer's and dementia. And so and I think I mean, sometimes almost daily, and I'm 5,000 miles away, that we are working through these situations and issues. And we have resources. I have siblings who are supportive. We have options because of where they are. And I think about people all across America and all across the world that this is going on in families all over the country and all over the world. And so I was very moved by your presentation. I want to thank you for this work. And I apologize because you may have covered this, but I was having intermittent connectivity, speaking of. And as you know, the Matt's Health Foundation is very data driven. And we have produced 2 senior scans. So one, I just offer up our data because we're the only place in Alaska where the in-migration of older adults is greater than the out-migration of older adults. So, as Ralph probably shared, Alaska 9 years running has the fastest growing older adult population, but Matsu has the fastest growing older adult population. And we really looked at that data. And so one of the places we focused was senior falls. So the last time we looked at it, we had $5 million in charges for older adult falls at our hospital. Now that's just looking at Metsi regional data. It's not looking at Providence or Alaska Regional or Alaska Native Medical Center. So I would wager it's higher now, could have even doubled for all we know. We got hooked up with another foundation that's on the East Coast that worked with Johns Hopkins, and which and I can't remember the name of the project. I can look it up, but I can't remember. But it was around preventing older adult falls in the home. And it sounds like you talked about the home modification project, Emily, that you had. We have tried, we've taken several attempts to work with local providers like senior centers to basically implement this program, or it's an evidence-based program or something similar, and have just we've not been successful. And so I just want to put it out there because it is neither one of my parents have fallen. That is going to be there's just no question that that's going to take us over the edge, right? And the quality of life and the cognitive decline that happens when older adults fall is so significant. So if we can prevent that, so I think of all of those ER visits, that's just the ED visits. I'm just talking about $5 million in charges on the ED visit side, not any inpatient, surgery, and I'm not talking about any of that, right? Yeah, we're talking the tip of the iceberg, right? And so, but if we can prevent those falls, most of which happen in the home, I mean, the quality of life is so much greater for folks, right? And so, I just want to present this enormous business opportunity for you, and two, just maybe just hear your thoughts, and maybe it's something we should have follow up and have a conversation with you. Probably know, I know Jacqueline knows Vandana on our staff who is leading this workforce she's leading the workforce development work, but tied into Health Ties. So anyway, just love to hear your thoughts on that.
Yeah, so Alaska has the highest rate of falls with older adults than anywhere in the country. So we know it's an issue. And like you said, that's $5 million in the ED alone. You're just starting the money that's happening because of these falls. And I believe I know the program you're talking about with Johns Hopkins. Is it Capable? Yeah, so it's for those who aren't aware of it, it's a program where older adults have several sessions with an occupational therapist. One includes a home safety assessment. They have a nurse that comes in, reviews medications to make sure there's no interactions that could be causing balance issues, making sure people aren't over medicating, under medicating. And then they get a day with a handyman, and the handyman comes in and does kind of minor projects, grab bars, fixes stairs, railings, and it's been proven to save a ton of money in healthcare costs and help people stay at home. So I would love to talk with you about that. I was actually and that's where I'm working on, like, how do we scale this? Because obviously I'm only one occupational therapist and the only one who does the skills to care program. So I'm in this kind of place where I'm trying to scale and forge partnerships so we can help more people. That being said, there is grant programs, right now through Alzheimer's Resource of Alaska. They received a large grant for the Alzheimer's Disease Program Initiative, lots of federal funding coming in. So I'm talking with them, and I did tell them about the Capable program, but I think it would be a good conversation to continue to see how we can make some of this stuff happen and on a larger scale.
If I could just step in for a minute, Elizabeth, I'm working with Vandana and Kathy Schwartz and others at Matsu Health Foundation with the idea of maybe bringing Matsu care providers together to look at ways that we could collaborate. Emily and other providers have also offered that they'd be willing to go out to the Matsu Valley maybe twice a month or something. So if we could collect. So I think there's real opportunities for partnerships.
Thank you. Really, we welcome that opportunity, and I'll circle back with Vandana and Kathy as well, because it's been a while. I mean, we had like pretty significant failure with our investment in this project Capable with local senior centers, but maybe there are partnerships there that could make it thrive and bring capacity.
Absolutely. Thank you.
Great. Thanks, Elizabeth. All right. Any other questions online or in the queue? I just have to say, listening to the conversation this morning, and particularly Elizabeth's story about the challenges of dealing with aging parents and particularly with dementia. I after this meeting, I have to compose an apology to my board of directors because yesterday during our board meeting, I got a call from my dad's vet's office that somebody had brought in his dog, and he and his dog were separated. And that's bad news in our family. And my dad was out. It's a long story, but he thought his dog was lost and was looking for his dog. But under stress, he has dementia, but under stress, he makes bad judgment calls. And so I put in the chat, there is a local search and rescue group that you have to wear a watch, but they can track vulnerable adults who are missing, and it's a tremendous local service. We unfortunately we're not set up for that, but we have enough family members locally that we mobilized and found my dad in relatively short order. But as we analyzed the situation last night, it was like we were just fortunate because the only phone number on the dog was my dad's landline, and he won't take his cell phone with him. And the dog had his rabies tag on with the veterinary office on it. So they took the dog to the vet who has my cell phone. And anyway, it was a long process. Everybody's safe, dog's safe, dad's safe. But it's just an example of how things fall apart rapidly. And I don't know about anybody else online. My dad is just 80 years old, but he is determined to live independently. His Uncle Albert lived to 92, so he figures he can live independently till 92. But at any rate, things can fall apart quickly, even if somebody is a high-functioning person under these circumstances, and all the little things that did and didn't work yesterday were definitely a lesson in other things that we need to be doing. So
Well, Netta, if you don't mind, I put in the chat another company that we're working with. Actually, Emily is also a part of this project. There's a group called Amisa that is using the Apple Watch to create geofencing around elders so that they can be tracked. The person that started that actually is a former federal officer who worked to find lost and missing children. And so he's a pretty earlier stage startup, and he's partnering with researchers and educators across the United States, because what he's hoping to do is to have people opt in and provide their data to researchers. And so we've actually connected them to a University of Alaska Fairbanks group led by Dr. Kelly Drew, who is actually using research that she's doing on hibernating animals to improve dementia and Alzheimer's care. So there's so many, again, these connections are amazing, and the work that we can do together would help everyone, including your dad. Wouldn't it have been awesome for him to have this geofencing, and then we can connect them also to the search and rescue group. So super exciting. So sorry that happened, but I'm hoping that there will be improvements in the process.
Yeah, thanks for that, Jacqueline. I appreciate that. Yeah, it's you know, in this particular case, the challenge that we have is with the technology, whether it's a watch or a phone or whatever it is, and his reluctance to engage with that. And so I can see the right mix of services for him is probably a little bit of us getting trained better, him getting maybe trained by somebody that could help break down some of that resistance, and the right technology to help solve a problem like we had last night. So I don't know. It seemed sort of like serendipity that thing happened last night, and we were having this session today. So, all right. Well, I don't see any other questions coming in.
I just have a comment here.
Sure, go ahead.
Oh, yeah, this is Ed McLean. So I've been with Commonwealth North for a long time. So I am a 72-year-old elder that has fallen a number of times, had strokes, and my adult son does track me with my Apple Watch, as does the local, and I've got that local number put in. And the comment, I was so thankful for this session tonight. I really want to thank you all, not just for your time, but for what you do. I'm really lucky because my retirement plan is super excellent. But your comments before, we just really need to keep those in mind. Prevention is morally the right thing, and it's economically the right thing to do. I've got the economic means to be able to afford all that, but I've got friends of mine that don't have those means, and they walk with that kind of risk. And it's totally unnecessary in a society such as ours. So it's really frustrating. So I really want to thank you. I'm going to look into the Amisa as a program as well. So thanks for bringing that one up. I just wanted to thank you all as a 72-year-old who does fall and who does want to live on my own. So thank you. Thanks, Anita.
Great. Thanks, Ed. Appreciate that. All right. In one last call before we sign off. Okay, I'll bring Ralph back in. Ralph, you want to have any closing?
Well, again, I just want to thank the Jacqueline, Emily, and Sameer for joining us today. And I've really been impressed with the quality of the programming that we've been able to bring in for this series. I had mentioned to Renetta that I was a little disappointed with the size of our audience, but she's pointed out that everyone's gotten used to just watching it when they want and downloading it, which is fine, except the exchanges are useful. And I need to somehow get that message out there to people that watching it, you know, I mean, I get turning it on while you're on the treadmill. I get that, like everyone else. But There's also the piece, and this is sort of a general comment about these kinds of events, is that time shifting them doesn't solve all of our, doesn't provide necessarily the networking that we need to solve these problems. So if you're out there listening to this afterwards, let us encourage you to join some of these events live, because I think there is an important part of it. But anyways, thanks very much for this. Again, our program will be continuing with some more programs through the summer in this series. So if you're on our mailing list, you'll get that. And we will be working towards the fall of this group to put together some sort of a report. In fact, Mary Capriva, who's one of the participants here today, will be the lead author on that report for this study group on chronic disease management for Alaska. And we're hoping to have something that will be available by the time the next legislature comes in to better inform what's going on in the state of Alaska. So thank you all for joining us today. It's been really an enjoyable session.
Thank you.
Thank you.
Thanks, everyone.
Take care.
Take care.